Namaste and greetings to you all. I am Vaidya Vandana Baranwal. Currently, I live in Dublin, Ohio. I continue to practice and teach Ayurveda, and I have founded Ayurvedatri. I am going to talk about scope of practice of integrative approach of anesthesia in obstetric surgery. As the world is experiencing this pandemic, as we are experiencing COVID-19, today's medicine is in the midst of an undeniable crisis. Reforms to healthcare has never been more important. We need to look up what we are offering and what the limitations are. The approach of medicine to the body as a physical entity and using science and technology has shown its limitations. There is need to reform. There is need to have an integrative approach, a holistic approach. Body is not just a physical entity. We need to contemplate on its spiritual aspect and uh, what Ayurveda says is mind, body, soul aspect. I will share my slides now and I move to my presentation. So today I'm going to talk about scope of practice of integrative approach of anesthesia in obstetric surgery. And integrative approach is not something new. Since long time, National Institute of Health, USA has dedicated a separate institute for scientific research on the diverse medical and healthcare systems, practices, products, which are not generally considered part of conventional medicine. And this was launched under the name of National Center for Complementary and Integrative Health. Formerly, before 1998, it was called the National Center for Complementary and Alternative Medicine. In 1998, the name was changed to National Center for Complementary and Integrative Health. So the importance of integrative health has been realized and it has been there for a very long time. And most of the majority of the countries are trying to develop an affordable universal healthcare plan also. So integrative approach to health is it is a thing of global interest. And in India, we have advantage as India is beneficiary to ancient art and science of healing. In India, for the time immemorial, we have been using these ancient practices of healing of Ayurveda, yoga, Siddha, and various other traditional medicines. India have vast resources of herbs, minerals, metals as well. And the people have known for a long time how to use these resources as medicine. The good thing is that Indian government recognizes and gives license to both traditional medicine practitioners as well as modern medicine practitioners. And India have this wonderful opportunity to develop a robust integrated approach to health, and it can prove as a model for global affordable health care. Let us look up at some of the merits of Ayurveda. When we are going to have an integrative approach, there is need to look up at it at scientifically because this integrative approach should be based on regulation and scientific evidence. So, looking up at Ayurveda, we see that Ayurveda is very human and personalized in its approach. Ayurveda is human because it does not look up at the human body just as a physical entity, but the concept of body in Ayurveda is inclusive of mind, body, soul, and senses. Ayurveda considers the spiritual aspect, psychological and emotional aspect, and Ayurveda gives immense importance to senses and sensory organs because Ayurvedic science believes that our sensory organs are the seat of our senses, which are the windows, which are our windows to the outside world. This is how the environment and other external uh, leads affect our mind and body. So it is very human in its approach that it considers not just the physical body, but mind, soul, and senses as well. Ayurveda is very personalized, or we can say that it is highly individualistic in its approach. The five element theory of Ayurveda says that Vata, Pitta, Kapha in each individual are present. Their qualitative proportions are highly unique to that individual. And this is decided at the time of birth itself. So every human being is born with their own unique mind and body type, and they need the diagnosis and treatment based on their mind body type. So Ayurveda is highly personalized, and Ayurveda is holistic because it considers body, mind, soul as a human, then family, then community. It also considers the environment, universe. So it is very holistic in its approach. The health in Ayurveda is just a step towards our journey for the liberation from the cycles of life and death. So Ayurveda is very holistic in its approach. So Ayurveda is human, personalized, holistic. Ayurveda have vast wealth of resources which can be used as for therapeutics, herbs, minerals, metals, and Ayurveda have vast science that has developed these resources, how to refine, use, make combinations, formulations. So Ayurveda have vast wealth of these resources as well. Another beauty of Ayurveda is that all the Ayurvedic texts are documentation of the experience and observation of its ancient teachers. And those teachers have been free from the worldly desires. They were not the servants of their senses. So the documented texts that we read today are highly reliable scientific resources. So there are many merits to Ayurveda. Looking up at Sangyaharan point of view, let's see what Ayurveda offers in the field of Sangyaharan. For painless surgery, Maharishi Sushruta has used the word Sangyaharan. So Sushruta Samhita is one of the most authoritative texts for surgery in Ayurveda. Sushruta Samhita has arranged in a systematic method the surgical experiences of the older surgeons. So again, it is a documentation from which we can learn. Sushruta has described some the dravyas for as anesthetic agents like madhya, wine. One of the ancient texts, which is not exactly Ayurvedic, but comes from the ancient Indian resources, Bhoj Prabandh. This historians believe that this text is from 1000 CE. This text describes moh chuna as an anesthetic agent. Mohchun was used for the surgery, cranial surgery of the king Bhoj. Charak Samhita, another authoritative text of Ayurveda, has described Sura to be used as an anesthetic agent for surgery. So in Ayurveda, we do find description of anesthetic agents to be given before surgery. There are many herbs that has been described in Ayurveda for Sangyaharan. Some of them have been used, and there are papers published about their uses. They are Vacha, Ecorus calamus, Ashwagandha, Videnia somnifera, Jatamansi, Nordoistakis jatamansai, Brahmi, Centella asiatica, Parijat, Nyctanthus arbotristis, Parsi Kiavani, Hyoscyamus niger. They have been described by numerous research scholars for pain and swelling in the patients. Ayurvedic herbs for Sangyaharan has been documented in other Ayurvedic texts also. Bhav Prakash, which is a book of Ayurvedic pharmacognosy, describes the use of ahifene and bhanga. Ahifene is Papaver somniferum and bhanga is Cannabis sativa. They have been described in Ayurveda as analgesic. Opium has been derived from ahifene, and today it is one of the main sources of narcotic analgesics. So safety of these herbs remains to be evaluated in obstetric surgery, but I'm just putting focus on the important herbs in Ayurvedic text that has been used for Sangyaharan. So what is the importance of Sangyaharan in obstetric surgery? Ayurveda describes, there is description of sensory and motor nerves as well as Sangyavahi and Agyavahi dhamnis, and they have been used for the management of pain. Management of pain is important because during labor, the women experience labor pain, which is considered as one of the most excruciating pain that human experiences. And all kind of surgery involves pain. So pain management is one of the chief aspects of Sangyaharan. What are the interventions that are used in Ayurveda for Sangyaharan? The interventions are two-pronged. There are pharmacological and non-pharmacological. Pharmacological interventions include herbs and herbal formulations. Metals, minerals are also there. And then there are dosha balancing interventions. And it could be Panchakarma, especially Basti, which is Vata is very known to be notorious for causing pain, and Basti is considered one of the chief interventions of Panchakarma for balancing Vata. So it is a pharmacological approach. In non-pharmacological approach, prayer, mantra, meditation, breathing, Abhyanga can help in management of pain. It is the mind that affects the body, and it is the body that affects mind. If one is strong, it can handle the pain of the other. So prayer and mantra and meditation, when practiced with that intention and focus, they increase the threshold how we experience pain. So it can be helpful. Besides that, in Ayurveda, fumigation has been described, dhupan, and one of the research paper proves that uh, when Ayurvedic dhupan from done with the nim, sarshap, ghrith, and sandhav, that is nimb and mustard seeds and rock salt and clarified butter, is done for 10 nights, twice a day after surgery. Then it has been proved by research that it helps controlling and shows antibiotic and antifungal activities. So Ayurvedic fumigation can be used, which is very safe. And uh, what is the scope of practice of integrative anesthesia in obstetrics? How and when we can intervene? So it can be done from the conception till delivery, post-delivery, before delivery, pre-operative, post-operative, post-discharge, and for pain management as well. So it is at every step of this journey in a woman's life for pregnancy in obstetrics, the Ayurvedic interventions of anesthesia can be used. So before delivery, uh, Sangyaharan can help in first trimester, second trimester, and third trimester. Along with the, as it is not just Ayurvedic approach, it is integrative approach. The routine test should be combined with counseling, meditation, breathing exercises, food, eating habits, and dincharya. Daily routine could be a very important part because it is very vata balancing. Daily routine, when things done on schedule and when they are in balance and harmony with the nature, with the mind and body type of the person, is grounding, balancing for vata. And like I said before, balancing of vata is an important part that reduces anxiety, that helps in the management of pain. So these interventions can prove very helpful. When the term pregnancy arrives, it could be that patient has been decided that it would be a operative delivery, or like Caesar would be, it could be planned Caesar, or it could be an emergency Caesar. So pre-operative intervention of Sangyaharan is very important in both the cases. If it is planned surgery, then the counseling and meditation and breathing exercises can be practiced, and patient counseling can be done in advance. If it is emergency surgery, The time is less, but still patient can be taught to focus on breathing and meditate upon a mantra that helps. The practicing of Om has shown to help in management of pain as well. It also helps, this kind of intervention helps elevate stress, elevate and modulate anxiety, and it helps in post-operative recovery and wound healing process. So benefits of integrative approach pre-operative are that it improves the patient compliance. There are less chances of wound infection. It shows better wound healing, and there is shorter hospital stay. So pre-Ayurvedic interventions are very important. Pre-operative interventions in Ayurveda are called, post-operative interventions in Ayurveda are called Vranitopasan, is staying in a clean and ventilated room after operation. And all the attendants and the patient themselves wear preferably white or the clean clothes. They keep their nails and hair short. And they it is focused that they avoid negative emotions, fear, grief, worry, jealousy, anger. If these negative emotions are avoided, and if these mentioned protocols are maintained, and patient is surrounded with a loving and caring family, friends, and hospital and staff, it helps in the management of pain. They are able to focus their mind somewhere else, and they experience pain less, and it helps in the recovery. And what they eat, when they eat, these things are also very important for post-operative recovery. They can help in the wound healing and shorten the hospital stay. Post-operative intervention also include not just these non-pharmacological approaches, but some pharmacological approaches where Ayurvedic medicines are prescribed. I mentioned before in my talk that Ayurvedic medicines do not necessarily need the evidence base of modern research, because Ayurvedic texts are the documentation of the experience and observation of Ayurvedic physicians, teachers, and practitioners. And those sages, those teachers in ancient time were free from the desires of the world, free from the worldly desire, and they were not the servants of their senses. They worked for the benefit of mankind. They documented and gave this science of Ayurveda for the benefit of humankind. So these these formulations can be used with confidence. And in obstetric post-operatic surgery, these some of the medicines are Dashmulquat or Dashmularishtam, Dhanvantar Kashay, Jirkarishtam, Vidaryadi Kashay, Sukumar Kashay, and Shatavari Kulam. These are the Ayurvedic formulation generally used post-operative or post-delivery in Ayurveda. Some of the formulations which help in post-operative analgesia are Dashmulquat, Dashmularisht, Shatavari Gulm, uh, Karmardadi Yog, Triflagukulu, Vidaryadi Kashayam. Some other post-operative formulations that can be used for different complications, like complications of breathing, Kanakasav or Pushkarmul Kashay; for sore throat, Vasarishtam or Vidaryadi Kashayam; or for nausea and vomiting, Shatpushpadi or Jirkarishtam. In case of post-operative urine retention, in urinary retention, Trin Panchmul Kashay, Varun Shigru Kashay, Punarnavashtak Kashay, Gokshuradi Kashay, Varunadi Kashay they have been in use for a long time in Ayurvedic post-surgical wards. There have been many research papers published about them, and they have been documented. So post-operative nutritional care is very important, because if nutrition is correct, it again gives patient strength, and it affects directly wound healing and hospital stay. It helps in management of pain as well. So for post-operative nutritional care, the Shmul Kashay and Shatavari Gulam have been considered very important. And one Ashtagun Mand, this preparation is like, I'm talking about nutritional care, so it is given as food but herbs has been added to it, like it is prepared from mung beans and rice, to which with the sesame oil, to which dry ginger powder, black pepper powder, pippali, long pepper powder, coriander seeds, asafoetida, and rock salt has been added. It is seasoned, and these combination herbs are added from the top. This gruel is very much powerful for increasing the digestive power. It is carminative, helps in bowel movement. Uh, so this gruel can help come out from the side effects of anesthesia as well, and continence of urine flow and abdominal discomfort. Post-discharge integrative approach. Once the patient is discharged and as at home, some of the follow-up, their family can be educated about how to take care of the patient when the patient is at home. So family care or the community care, scheduling the visits, diet plan, self-care routine can prove very effective. So, diet plan, what the person can eat, it should be planned according to their mind body type, how they eat. Because in Ayurveda, what the person eat is important, how they digest is equally important. And this is the important part here, to how they digest, how they cook, and how they eat. For that, the plan should be given an individualized plan. And for self-care routine, I mentioned this, the importance of self-care and routine before also. When patient is given a individualized routine for, say, in the follow-up for a week or for 10 days, it helps in the recovery, and it helps when the doshas are in balance, when the body knows, like when the schedule is there, our organs are not challenged. Research paper has shown that when the things are done on schedule, we feel more healthy. So it adds not only to the quality of life, it gives them a plan for living a healthy life. So taking self-care routine, taking care of themselves is also a very important part of integrative approach in Sangyaharan. To enhance the recovery after surgery, that is called ERS. It reduces the surgical stress response, it optimizes the physiologic functions, it facilitates recovery, it improves the quality of life. So, Ayurvedic Sangyaharan can be the part of ERS as a part of an integrative approach. And in that, we can include the directives about the lifestyle, daily routine. We can include the directive about the food and diet habits. We can include Ayurvedic herbs and formulations. I have given a long list of analgesics, anti-inflammatory, the medicines that work on the respiratory system, the medicines that work on urinary system. So for integrative approach of Sangyaharan, we have vast wealth of knowledge here. And before I end my talk, I would like to say aloud this disclaimer that this presentation is for educational purpose only, and it is not to be considered a medical advice. Ayurvedic formulations are medicines, and every patient is advised to take it on the recommendation of their doctor only. Please check with your medical physician before you make any healthcare decisions. Thank you and namaste.